money in this province. We spend, as I mentioned, more per capita than virtually any other province. And the question was directly for healthcare, did you say?
Healthcare and education.
Healthcare and education. The key on healthcare and education is to be decentralizing the way the spending happens right now. Currently, we have a government that believes if you can hire some really smart guy in Edmonton and give him the budget to manage, he'll be able to figure it all out. Now, I know Stephen Duckett's probably a pretty smart guy, but no one can understand how to manage a system of $14 billion. The key is, once again, to make sure that that funding gets down to the level of the local hospital. And we used to have a system like this when we had the old hospital boards. What we need to do is get to a system of activity-based funding. If you do activity-based funding, where the funding follows the patient directly to the facility, you will see a huge number of efficiencies that will happen at the local level. Nadeem Esmail is an economist with the Fraser Institute. He talked about how there may be as many as 30% dead weight loss in our current healthcare system because we operate it as a monopoly. I suspect we'd see the same thing in the education system, potentially a 30% dead weight loss. And we've already started in the education system by finding those efficiencies. We've got the monopoly board system, but we also have the charter school system where the funding follows the student directly to those schools. And then you have the principal and the teachers and the local parent council making the decisions on how that money should be spent in that school. We need to see the same thing happen in hospitals, and I think you'd end up with an amazing number of efficiencies and no need for new revenues.